From today, we are starting our most important playlist, that is the common cases in the physiotherapy. In this playlist, we will study the neck region, upper and the lower extremity, and also the trunk. The most common cases that come in the physical therapy department we can discuss in this most important playlist. So, let's start. First, the neck region. In the neck region, first we will study cervical spondylosis, then cervical disc prolapse, torticollis, and the Erb's palsy. In the cervical spondylosis, it is a degenerative disorder at the level of cervical spine. Degenerative disorders mostly occur in old age. It can be described as a result of degeneration of the intervertebral disc or the corpus vertebrae in the cervical region. There are 7 cervical vertebrae. The nerves in the cervical region are the 8. We add one nerve in the each cervical vertebrae. If it's C1, then the nerve pass under C1 is C2. So this is the pattern. Degenerative disc disease, the formation of osteophyte, facet and uncovertebral joint arthritis, inflammation of the joint, ossification of the posterior longitudinal ligament, or the hypertrophy of the ligamentum flavum, or any spinal stenosis, means narrowing of the spinal cord. These are some possible characteristics of the degenerative disc diseases. In some cases, this degeneration also lead to posterior protrusion of the annulus fibrosis. In the between the vertebrae there is a intervertebral disc. In around we have annulus fibrosis, and the middle we have nucleus pulposus. So there is also a reason that the posterior protrusion of the annulus fiber of the intervertebral disc can cause compression of the nerve roots, which in turn can lead to the pain, motor disturbance, muscular weakness, sensory disturbance. All the symptoms that the nerve compression can occur. As the spondylosis processes, there may be even interference with the blood supply to the spinal cord also, where the spinal vertebral canal is narrow. When vertebral canal is narrow, the blood interference to the spinal cord also lead to progression of spondylosis. This is all the spondylosis in which there is spur formation occurs. This is the define and some characteristics we can discuss of cervical spondylosis, and there is a sign and symptoms of this disorder. And here we go for the treatment. In the treatment we can use TENS, transcutaneous electrical nerve stimulation, for almost 20 minutes. If there is nerve root involvement, we can use ultrasound for the 5 minutes. Ultrasonic therapy, we can use hot packs for the 15 minutes, because when the muscles are stretched, when the muscle are tightened, we can use hot packs to relax the muscles. We can also use massage therapy for 5 minutes. Always remember, if there is tightness in the cervical muscles, we can go for stretching exercises. Range of motion exercises are also helpful. In this x-ray, degenerative changes you can see in the cervical spine. These are the bony spurs that are most common in cervical spondylosis and which cause narrow of disc space. And when the disc space is narrow, the nerve that comes out of that vertebral level can compress, and all the nerve symptoms you can see in the patient complaints. These are the motions, range of motion exercises, and strengthening exercises we do for the weak muscles. Strengthening exercises in the same direction, 10 repetition each. This we discuss most common cases in the physiotherapy. The first we will discuss is the cervical spondylosis. Its treatment, its consideration, stretching exercises, strengthening exercises, how they become helpful. We will discuss it in shortly. And this is our question. Please answer this. Is osteophytes formed in the cervical spondylosis?